So now we're going to take a look at what happens to the mother during pregnancy. So I think you're obviously familiar with the idea that there is some weight gain, right? So here's a woman, 16 weeks, 21 weeks, and you can kind of see as she goes through, she's gaining weight. And the reason why is there's a person growing inside there, and here's a little baby who's definitely not a newborn, but you kind of get the idea. Like a kid came out of there. So strange. Um, as for the father, there's not as much change that happens with him. So anyway, the average weight gain is about 30 pounds. And if you take a look, this is just kind of a summary of where that weight comes from. The baby's only 7.5 pounds. But you can see there's some other things. The placenta is 1.5 pounds. The uterus, expands to accommodate that baby and gains about 2 pounds. We had amniotic fluid and blood and other things. Um, there's a lot of things that are adding weight to prepare for this pregnancy. Um, there's also a lot of other changes. Pregnancy is hard on the mother's body. The cervix develops a mucus plug, and the purpose of that mucus plug, you can kind of see it in yellow here, the cervix being that opening at the base of the uterus, if you remember. The cervix has that plug to prevent bacteria from reaching the fetus and potentially causing an infection. So that happens. The uterus undergoes a dramatic change in size. So before pregnancy, the uterus is about the size of a pear, but just before birth, it has expanded to be about the size of a basketball. And then, interestingly, one day after birth, it's down to about the size of a grapefruit. And I have been told by mothers that that's actually a pretty painful process. Because it's like contractions, um, like cramps, basically, like menstrual cramps, as that uterus kind of shrinks down after birth to that normal size. So it changes quite dramatically. The hair and nails experience more growth, and that's because of higher estrogen levels. And so this can actually lead to a fuller head of hair, longer nails, but then it can also lead to hair in unwanted places like the belly and some other things, and then that hair can fall out in clumps after childbirth. So, it's kind of a nice little perk for a while, but then it double-edged sword there. There's also changes in the skin. There's this kind of pregnancy glow that you might hear people talk about, and basically there's increased blood flow to the skin. I struggled to find a picture of this. People look at this like that's makeup, and I don't know, but it's a thing. Trust me. Basically, increased blood flow to the skin causes that, and then there's more melanin production. Which is just kind of a random thing. There's no reason for it, but it can lead to things like mask of pregnancy, which is kind of this darker patch on the face, and then linea nigra, which is this darker line down the center of the abdomen. So just kind of some random changes in melanin production. Stretch marks can also happen. The enlargement of the belly can cause collagen in certain parts of the skin to break down, and then it can lead to these stretch marks. These are pretty bad ones. They typically are kind of a clearish color, but that's a thing, and sometimes they go away, but oftentimes they don't. Um, there's a hormone called relaxin released during pregnancy that loosens your joints and ligaments. And you might think, well, why would we want to loosen joints and ligaments? Well, remember, the fetus has to come out through that hole. And so the pubic symphysis here, this little bit of cartilage, has to like stretch out to accommodate the baby emerging. And so relaxin basically loosens up that cartilage to facilitate its stretching out. So relaxin is important, but it can also loosen connective tissue in other parts of your body, and that can lead to some back pain because your spinal curvature kind of gets a little bit more severe because it's just looser, and so the weight of the body has caused it to do that. It can make pregnant women a little bit more clumsy and cause some other issues. There's various hormonal changes that happen during pregnancy that can have seemingly random effects. Morning sickness is basically just a fancy word for nausea. I'm not sure why they call it morning sickness. It can strike at any hour of the day. And it's linked to higher levels of HCG. That was that human chorionic gonadotropin. That was that hormone released right away to kind of tell the body it's pregnant and not to menstruate. And then higher levels of estrogen as well can contribute to that. And so during the first trimester in particular, women oftentimes feel just kind of sick to their stomach and kind of crummy. Um, you have an increased risk of gestational diabetes. So the mother's metabolism shifts. Um, it kind of changes, and so it uses more fats, and then the pancreas become less sensitive to insulin, and as a result, diabetes can develop. And again, oftentimes this is just during pregnancy, but it can actually lead to um, long-term diabetes as well. There's decreased smooth muscle activity. And this is a good idea because the uterus is actually smooth muscle. So the baby's inside this muscular sac called the uterus. It is smooth muscle. And so we don't want premature labor to occur. So by reducing smooth muscle activity, we prevent this uterus from constricting and like triggering childbirth prematurely. So it's actually a good thing, but there's other parts of your body which are smooth muscle, your whole digestive tract, for example. And so that can lead to constipation because the large intestine isn't able to move food through the large intestine, so too much water is pulled out. It can also lead to heartburn because acid from the stomach is able to kind of sneak up into the esophagus because that little valve in between is not working as well. The organs get crammed. And so again, this also contributes to digestive problems because the intestines are getting mushed against and everything else. Look at the bladder kind of getting constricted, and so pregnant women often have to urinate quite frequently. Some women gain a shoe size. So, you've got this arch, right, to your foot. Well, all that added weight of pregnancy can actually flatten out that arch, and then that extends the length of the foot. And so some women after pregnancy have actually gained a shoe size and have to restock that whole shoe closet. Um, so the conclusion of this is thank your mother. Being pregnant is a lot of work and it's very hard on the body and it can cause a lot of short-term and a fair number of long-term issues. And so just be aware of that. I've been told this is the best, you know, the best sex ed talk ever. So yeah, be aware. There's a lot of negative things associated with pregnancy. But what a wonderful experience. And as a father, totally worth it for me. I mean, I just had to sit there really. Anyway, finally, we have birth. So, pressure of what happens in birth is that as that fetus grows, the pressure that it puts on the uterus causes the release of a hormone called oxytocin. Oxytocin then causes uterine contractions. And then it's what we call positive feedback because those uterine contractions create a little bit more pressure because it's like squeezing the fetus, which puts more pressure on it, which releases more oxytocin, which leads to more uterine contractions, and then this kind of spirals until finally the uterus is like, all right, I'm popping this thing out of here. Um, so you may have heard of Pitocin. That's like an artificial oxytocin that's used to induce labor. So that's where that name comes from. Oxytocin is the natural hormone, and Pitocin is a synthetic one. Um, Once this starts to happen, the cervix begins to dilate. So the cervix, remember, is that opening to the uterus, and so it kind of stretches out here and begins to open. Here it is at 1 centimeter. I guess that's all I have. Eventually it continues until 10. And at 10 centimeters, that is when um, it's coming up. Hold on. So the cervix begins to dilate, and then that mucus plug in the cervix begins to dislodge, and then the amniotic sac can rupture, and that means that the water has broken, and so now that baby's ready to come out. So at this point, the cervix continues to dilate. Here's that slide I was looking for before. And so you can see here's a 1 centimeter, 5, and then at 10, that is when it's considered fully dilated and it's time to start to push and try and get the baby out. Um, So the mother sort of pushes, she kind of contracts her abdominal muscles and kind of helps when the uterus naturally contracts, because remember the smooth muscle is involuntary. The mother kind of contracts her abdomen and kind of helps to try and you know, reinforce that contraction. And then slowly the baby emerges. So here's the baby all chill in the uterus. Um, Here's the amniotic sac ruptured, the cervix beginning to dilate, and then it begins to pop out. And what a lot of people realize is, you know, I always thought it was going to be this slow, gradual emergence of body. But when my children were born, I was struck because, you know, initially you just see the top of the head, like this little opening, and then the next round of contractions, you see a little bit more, and the next round of contractions, you see a little bit more, and you're like, oh my gosh, I think that's the head. Is that the head? And the next round of contractions, like, their whole head is just out, and you're like, ah, it's like that was my impression of both my children was because their head just is out. And what happens is after you get past that widest part of the head, then the rest just kind of pops out. And it's quite shocking. And then finally, there's one last step. You have to get the placenta to be expelled. And so there's a little bit more pushing to get that placenta out. So this poor mother, after all this, she's still not done because now she has to feed the baby. There's two hormones involved in this. Prolactin is the first one, and that stimulates milk production in the breasts. And interestingly, this is stimulated by the suckling of the infant. So as long as the baby keeps nursing, that will keep stimulating the production of more milk. And this is why a couple things. Milkmaids used to be a thing where you know the king, for example, his baby would, you know, the queen wouldn't nurse her own baby. She'd have some other lady feed the baby all the time. And that worked because any woman, once you have a baby, will produce milk, and as long as you keep nursing, then she'll keep producing milk. So whether it's her own baby or the king's baby, you know, they can keep producing that milk. And so that's why women can actually feed other people's milk. And then, um, and cows as well. You know, when we get milk from cows, this is why that works. We can just keep as long as we keep milking the cow, it will keep producing milk. And I don't think it enjoys it too much. And then the other hormone involved is oxytocin. This is what actually causes the release of the milk from the milk duct. So remember, oxytocin was also the hormone that stimulated the contraction of the uterus. So here it's stimulating the contraction of these ducts that release the milk from that milk duct. So that's also important for that uterus to sort of come back to its normal size. Remember, it goes from the size of a basketball to the size of a grapefruit. The oxytocin that's causing the release of milk is also causing the contractions of the uterus, which is part of why it comes back. So that's about it. We have given birth, we've fed the baby, and we're launched. So that concludes this course on human anatomy. Thank you guys. Hope you enjoyed it.